And we're going to talk about the differences between synthetic such as horse kind of, animal parts or something like that that makes them, or bioidentical, which is human identical. We're going to talk about the different options, how you can deliver those, the different ways in which they become available to our body, how they can help both men and women, what are the risks, if there are risks, what are those risks, and are they real risks, or are they fake risks? And then whether or not tonight you're going to decide whether that's something that you're a candidate for. We don't know. So I want to cover those topics for you. Kind of all medicine is reared in this topic of conventional medicine. This is how we're trained. This is our system. We're born and then we peak in our early 20s and then we start entering our 30s and then people say, it's pretty much just downhill after that. Well, this describes our wellness here tonight. This phrase coined by William Osler, the father of modern medicine, he says, the person who takes medicine must recover twice, first from the disease and second from the medication. People say, if this is such a good deal, how come my doctor hasn't told about this? This is some fancy newfangled therapy that's been out for 3 months. It came out at the same time the synthetic estrogens were coming out, and so the pharmaceutical companies will get behind that one, but not behind pellets because they couldn't patent it and make money on it, so they went the other route. So these went over into Europe and Asia, where they've been studied for the last several decades, and that's where all the data first place. So this is going to be the thrust of our topic tonight. Regenerative, preventive medicine. See, there's that curve in our 20s, but rather than start falling off, we extend the vitality. And so that is what we'll do with hormone therapy, is it's a way of healing and extending quality of life until clear out here into the 90s. Not just down here and then tiptoeing, but up here having that nice quality of life. It's a functional medicine approach. Here's what I mean by that. Let's suppose someone is feeling down and low in their mood, and they have sadness, and they can't sleep, and they're having anxiety, and they have all these symptoms of depression. Well, what we're taught to do in typical conventional medicine is the patient shows up, and we write them a prescription for an antidepressant. Well, that person doesn't have an underlying Prozac deficiency. They don't have a Wellbutrin deficiency. Perhaps they have something else going on in their life. Perhaps their thyroid is underactive, their vitamin D, omegas, they got some antibiotic use. Something else is an underlying root cause issue in that person, whereas the depression is the symptom, not the ailment. So in our modern system, we're taught to fix and cure. The patient comes in with this symptom, you give them this treatment, this fix, or this cure. I say, you know what, we don't have a lot of good answers for our chronic illnesses, blood pressure, cholesterol, diabetes, osteoporosis, stroke, a lot of those issues, cancers, those can best be dealt with by focusing on the underlying root cause out. And we want to embrace a concept called optimization, not just normalization. Let me tell you what I mean by that. Let's say, for example, that a person has some symptoms that drives them to go see the doctor. Dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, fatigue, no results in the gym, and so what people usually do nowadays is they Google it, right? They get on the computer, go ask your doctor about checking your thyroid, for example. So you go and get your blood checked, and then the blood test comes back, and then it has these little ranges. There's a reference range, something called the normal range. And so the blood test lands about right here. And the person reading the test says, looks to me like you're in the normal range is what they say you. You're like, excuse me, but I don't feel normal. That's why I came. I have all these symptoms. And rather than dismiss it or sweep it under the carpet or just go, there, honey, you're just getting older, we treat that. We move it to this side of the reference range. Now the symptoms all get better. We call that concept optimization. And guess what? You're still normal, if you know what I mean, but you're in the upper range. That, in essence, is what we're doing, is we're rolling back the clock, setting that back to the levels of your life where you felt your best in your 20s and 30s. So when you shell back or peel back the layers of the onion, that helps deal with the root cause. So that's what optimization is. And then it's not a one-size-fits-all approach, as I mentioned. It's customized to the person based on their kidney function, their activity level, their frame, everything they need. So we have a dosing website that we use. It has 4 million permutations. We plug in all these blood numbers, kidney function, activity level, all this stuff, and it generates a dose which is proven to be about 96% accurate first time through. And then we recheck the blood at 4 weeks to make sure it hit full optimization, and if it didn't, then we simply give them a boost at no charge to get them up to the optimal level. So it's all customized, and we hit it every single time, right? So the goal here, when we do the therapy properly, is to help you not just feel good, but feel great. I mean, truly feel great, and have it sustained. And so this is not a pipe dream. This is exactly what we're going to do. So not all hormone therapies are created equal. Hormone replacement therapy is not a one-size-fits-all. Everybody is unique and different. You all individually, just like me, we get to live in our own bodies. We know ourselves better than anybody else. We're unique and special and customized. You need somebody that's an expert, someone that knows what they're talking about. Here's why pellets, head and shoulders above the rest, is the best delivery system. It's right here. When you put a pellet in you, capillaries go around it. And then it starts being absorbed. So there's always a baseline absorption, but here's where the magic occurs. It makes you feel like wanting to go to the gym, even if you've never gone to the gym. So when you start going to walk, or you go to the gym, you start getting results. And the higher your heart rate goes, the more hormone you release. So it's released based on cardiac output. The more you work out, the more hormone you get released. Kind of like how our bodies work, right? That's why it's superior. It's the same exact molecular structure as human hormones. That's why I call it human identical, bioidentical. Bio means plant, identical, or life. Most widely studied form of natural hormone, steady stream of hormone. Most people don't even know it's there, and you don't have to do anything. We implant it in females. It lasts 3 to 4 months, so 3 to 4 times a year. In males, it lasts 4 to 5 months, so twice a year, maybe upwards of 3. Usually just twice a year. Helps the body return to their own natural state. Right kind of hormone, bioidentical, right amount, individualized dose, customized to your frame, right delivery system, pellets, where it's released based on cardiac output. So this is the bottom line benefit. Save hundreds of studies, 75 years experience, used in 5 continents, no roller coaster effect, steady state. So here's what it does. Increase energy for life, increase in drive, moods, relief from anxiety, PTSD, increased ability for mental focus, we've done that. No evidence increasing breast cancer, prostate cancer, heart disease. No blood clots. It's protective to the breast, brain, bones, and heart. In fact, they now feel that it's not that the estrogen caused the breast cancers, it's the drop in testosterone that the breast loses the protection that testosterone offers to prevent the cancer, which allows the cancer to show up. Not the presence of estrogen, but the lack of testosterone in female than a 30-year-old. Facts about menopause. It starts 15 years before the last cycle starts. Most women are affected in more ways than they realize it, and they never really get through it. They never really get over it, and they never really become asymptomatic. They might manage the symptoms, but they're never asymptomatic. Estrogen is really important. It's present in both men and women. In fact, us men need it. It's what makes us nice. We need some. We don't give you estrogen. You'll make some on your own and give you testosterone. But this is what it does for the lady. It makes their bones stronger, makes their skin softer. It's their happy hormone. Helps prevent them from developing Alzheimer's disease. Critically important. So much so that the ladies wanted it, but then in the 1990s, they had out a compound called Premarin. Have you ever heard of Premarin? Looks like this. This is Prem Pro. What does Premarin mean? Does anybody know? It's made from horses. It's actually a compressed term. It means it's made from pregnant mare's urine. Premarin. And that's what it is. It's horse estrogen. And it's made out of the urine, okay? So that study said, and it's oral. It was a tablet, and it was synthetic. Those two things went awry. Breast cancer risk went up, endometrial cancers went up, increased risk of heart disease, increased Alzheimer's, headache symptoms, blood clots, all the stuff you heard the horror stories about that cause ladies say, I don't want to take any of that stuff, right? all because of it being synthetic. When women lose their estrogen and their testosterone, their rate of heart disease goes back up to their male counterparts. It doubles literally overnight. So all these things were reported from the oral horse estrogens. 41% increase in stroke, increase in heart attacks, blood clots, Alzheimer's. So the ladies were really left with no alternative when that came out. Actually, there was an alternative all along, but most people didn't know about it. It's called health therapy. So the Women's Health Initiative said, worst outcome, wrong drug, wrong dose, wrong route. It matters whether it's synthetic, it matters whether it's taken orally, and it matters if it's the right drug or not. Right? So we don't want horse estrogens. There's no ladies here that have horse receptors in here tonight, right? Patches. Well, you can put the patch on, depending on where you put it. Depends on how much it's absorbed, because certain skin on certain parts of the body is thicker than the others. And 45% of the people don't absorb it, so that's when you got to change it every 3 days. Or you can do the creams and the gels. You got to remember to rub it in twice daily. And if you put it on one spot, it'll absorb more than others. Or this one is when it goes on to other people, babies or pets. I had a friend of mine who was getting testosterone gel from another doctor in the city that we're in. And he called me up one day, Dr. Secrist, I got to ask you a question. I go, what? He goes, my 1.5-year-old son is growing pubic hair. I'm like, what? I go, are you on testosterone? He goes, yeah, this doctor gave me the gel to smear thing. So he was cuddling his son. It was rubbing off on him. Now, thank goodness that's reversible. But who wants that, right? The sugar doesn't give you the brain, heart, and bone protection. The most popular sex hormone is called testosterone. Besides providing major symptom relief that helps us with our brain, our bones, our heart, and our relationships, it's present in both men and women. In fact, I was impressed to learn that over the life of the ovary, it makes 3 to 4 times the amount of testosterone it produces than it does estrogen. So it's the dominant hormone in men, large amounts in men. Men age 30 to 70 will lose 1 to 3% per year beginning in their 20s. I think it's closer to 3 to 4% per year. And women ages 20 to 40 lose half of their testosterone between 20 and 40 before they reach menopause. Okay? So pretty big deal. So, you know, if I have a patient or a man come in and say, hey, doc, things aren't working so well in the bedroom, can I get me some of those little blue pills? The average trained physician would say, oh, here you go, Band-Aid, here's a Band-Aid. But I know that 8/9 of the iceberg is below the surface, so I start asking questions. Hey, what's going on with your weight? What's your cholesterol? Let's check your blood sugars. There's all kinds of stuff happening in here that's going on in their system that ultimately leads to the ED that brings them in the first place. So that's how you think below the surface. Okay, well, this is the best bone builder. Testosterone builds bone 3 times the rate of our best drugs out there. Okay, not to mention all the other things it does. You will actually reverse osteoporosis. And if you haven't seen it yet, you haven't been doing it long enough. Because it takes a year or two for this all to happen, but you'll improve people's bone mineral densities. And that means you can get them off their osteoporosis drugs. How about arthritis? Does anybody here know anybody with joint pain? A couple of them, all right? By 2020, which is now, osteoarthritis will be the 4th leading cause of disability. One of the best indicators that my male patients come back to say, I know I need a refill, doc, because my knees are hurting again, my ankles are hurting. The relief from the joint pain is getting used up, and so it's time for repelleting. That's one of their best indicators. See, testosterone is a very powerful anti-inflammatory. So you get relief from those. You regrow the cartilage cells, possibly reversing arthritic tissue. How about Alzheimer's disease? Women get it 8 to 1, men get with low T are 3 times as likely to develop it. Recent advances, this just shows that there's no increase in blood clot activity, there's not increased risk of breast cancer. So us men, we get what's called andropause. We don't even feel like going to the gym anymore. So that's what us men have when our testosterone level drops. So here's the facts about it. We call it menopause, right? 20% of the males over 50 have low T. I think it's actually higher than that. Directly linked to blood pressure, cholesterol, diabetes, osteoporosis, sleep apnea, and it largely goes undiagnosed. Or it's underdiagnosed. It doesn't mean that it's full-blown through the bottom floorboards, but it may have drifted down over the years to the point where you have all these symptoms, even though it's not met the lab level. So it's probably a testosterone insufficiency on its way to a full-blown deficiency, okay? Here's probably one of the most important charts I'll show you tonight. You're welcome to take a picture of this. It's a remarkable chart of showing testosterone levels in young males. So if you want to get your camera out and take a picture, you're welcome to do that. These are thresholds, okay? So us men, think of men in their 20s. So testosterone should be maybe 900 to 1,000, okay? And then it starts dropping 2 to 3% per year, faster if they've ever used pain medication, if they've ever had a concussion, had their bell rung, been in the military, a blast injury. It starts dropping. As it drops below 900, we start gaining weight around our midsection, our muscles soften a little bit, and when it drops below 900, we've now lost the protection it offers against Alzheimer's disease. As it enters the 700s, we get metabolic. That means we start gaining weight around our waist. In the 400s, we get tired, our libido drops, our cholesterol goes up. In the upper 200s, depression, anxiety, PTSD symptoms all flare up. And not until it gets clear down to 230 do they typically have erectile dysfunction. The plumbing just doesn't work as well. We need our testosterone for our brain, our heart, our bones, and of course our relationships. So one of the things I love about the pellet therapy is it ramps you right up your boom to 1,000, 1,200. You're often around 4 to 5 months. For ladies, 3 to 4 months. In an appropriately less level for the gender, but that's for males, okay? So sometimes I get this question, hey doc, I heard once that testosterone might cause prostate cancer. Has anybody heard that before? Okay, it's a myth. It's completely an urban legend. In fact, let me introduce you to Dr. Morgenthaler, Harvard Medical School professor, leader in the urology circles, travels around the society meetings all over the globe. He's one of the keynote speakers in all the urology meetings. He has become the definitive authority worldwide on testosterone. He says there are 19 studies that show there is no increased risk in prostate cancer in men with testosterone therapy. He says the opposite is true. Low testosterone is associated with a high-grade prostate cancer, a higher stage of presentation. So not only does high T not cause it, low T sets you up for advanced prostate cancer, and then when it finally shows up, it's already spread. Okay, so it's the opposite. Think about it, common sense, all right? If high testosterone caused prostate cancer, you would think there'd be a whole lot of 20-year-old men running around with prostate cancer, right? This doesn't make sense. And the same holds true for women, right? If estrogen caused breast cancer, there'd be a whole lot of 20-year-old ladies running around with breast cancer out there. We just don't find that to be the case, okay? So it doesn't pass the sniff test at all. In fact, Dr. Morgenthaler, he is known, he's conducting small studies on some of his own patients who have small prostate cancer, low grades, and he's inserting testosterone pellets into the cancer. And some of those studies are showing regression of the tumors. So the safety has clearly been established. Relief from anxiety and depression. The brain fog clears. They feel like they can focus. They get deeper sleep and oftentimes remember dreaming because it hits the GABA receptors. And then instead of injuring prostate or breast, it protects it from prostate and breast cancer. Strengthening the bones and the heart and muscles, reducing body fat, lowering cholesterol, strengthening the tooth and the enamel and the nails, enhancing libido and performance. In fact, you'll get an increase in your own growth hormone by 22% when you have optimized testosterone. So you don't need to go out there and get HGH and shots and all that expensive controversial stuff anyhow. Cholesterol numbers. All bad numbers go down. All the good number goes up. There's no prescription drug available on the marketplace that I can write on my pad or send in that will do this. And it does it better than cholesterol lowering drugs. That's testosterone. In fact, here's a chart. I went and had my own heart scan done. There you can see, I revealed it. There it is. So this was October of 18. I've been using the testosterone for a few years now. Total calcium score is 0. This is an ultra-fast CT scan of my coronary arteries. It says I have no plaque and no calcifications in my arteries. And it says down here my coronary age actually says less than 35. So I don't know what that means, 29 or 28 or whatever. But I don't say that to you to impress you. But, and they say in Texas, it ain't bragging if you've done it, right? So my wife has the scan and hers is just as good. So again, a testament to the fact that I have a heart that's younger than a 30-year-old with this. Okay, so treatment comparisons. If you do shots, it's 104 shots a year. Creams, 730 times because you got to do it twice a day. Pellets, again, for ladies, 3 to 4 times a year, 2 to 3 years for men. Bone protection. So the men, sometimes they go for the shots. The shots are the cheapest. But I've learned that you get what you pay for because you get a big spike and then it drops off. And then you get a big spike and then it drops off. And we call that the roller coaster. And so it has to be processed in the liver rather than excreted in the kidney. So the cholesterol numbers go up and the liver enzymes go up. So plus, I mean, done properly, shots should be done twice weekly. How many weeks in a year? So that's 104 shots a year, right? Done properly. You could use the patch, but it only gets to 500. What was that number in the other slide? 900 to 1,000. That's the levels we want for males. So the replacement methods are basically this. The synthetics have the pills, patches, and shots. The bioidenticals have some of those, but the pellets. Yeah. Here's what you should know about your first pellet insertion therapy. Okay. Testosterone makes the kidney work better, as well as a lot of things. The kidney's job is to absorb sodium. When that happens, water follows. Some people will get a little bit of fluid retention because the kidney's working better. That's a sign that it's working. By the way, it's temporary. Lasts a few weeks, we give you a little diuretic, you pee it off. This happened to me. When I first did it, I was a little puffy. I think I got a chance to experience what my wife experienced on a monthly basis. I felt a little bloated. And so I took the diuretic, I peed it off, and it's never happened since. I've had 9 installations of pellets over the last 4 years. Okay, so I am a fan. Again, this can happen, it's temporary. If the breast tissue has not seen estradiol in a good number of years, it's going to reawaken it up because we're going to give you a healthy surge of hormones and vitamins. And sometimes the breast tissue will wake it up a little bit. If that happens, it's temporary. We'll give you a few capsules of evening primrose oil, and then that'll all go away. Some ladies can develop some spotting temporarily. Usually it's uncovering something that needs to be there. We give you a little progesterone to take care of it. If the face gets a little bit of temporary acne, which can happen in some women, a few, not very many, a simple antibiotic for a few to several days takes it away. It's no big deal. Usually it happens first time around. Men can experience temporary reduction in the testicular size because it reduces the sperm count. So males, if you're in the child fathering years of your life and you have not completed your family, this can be a very strong contraceptive for you. If that's not what you want, we put your pellets aside, let you complete your family, then you come and see us when that's all taken care of, okay? It's temporary, if it happens at all. Right? And we also mitigate that with a compound called DIM. So here's what it does. 3 other key hormones. One is thyroid. Thyroid is hair, skin, and nail. It's excellent therapy. And when done properly, it'll help you strengthen the hair, skin, and nails and metabolism. Vitamin D. D is a pro-hormone. When you have low D and low T simultaneously, you increase all causes of death in the body. So we want to fix those. And then ladies only get progesterone. Helps them sleep better, helps them relax in the evening, and it's protective to the uterus if they still have one. Testosterone and estradiol implants does not increase the risk of breast cancer. Do you mind sharing with the group what your typical charges are for a blood test or how you handle that in your area?
It's $150 cash pay, and that includes your pre and post. So
that is a good deal. If that's the same panel which I have, which I think it is, when we bill our patients insurance for that, that bill ends up being $1,800 to their patient's insurance, and so if it goes to the deductible, then that is responsible for them. Now we use the cash thing as well. Our prices are actually higher in our area. It's about $200. So that is a $2,000 blood panel for $150 to $200. It's an absolute bargain. So anyhow, tell me your name.
My name's Rob Heffley. I've been on pellets for 3 years, and it's the one thing I would not take away.
How was life for you before pellets? What were you experiencing?
Not great. I can tell my knees, my back, my neck, everything. It's a game changer. Just being able to do stuff.
Anything specific? I mean, how's your sleep?
I sleep way better. And just, energy, it's above all, because like working out, it's that's to me, a huge part of it, not being wore out after work, going home, do those things. Travel a ton now, I feel like a lot more energy for my kids. Just exciting.
So you can identify with some of those.
Yeah, that's one of those things. It's one of those things. I sought it out because I had several naturopath friends, and I actually drove to Little Rock before I found here. This is something, just go try it out. I brought family here. It's like, hey, this is it's a good thing for your health. It's preventative. Don't think about all the little things testosterone does. It's you get into it too.
Yeah. Good. Thanks for.
I thought when I turned 60 that all those things was just normal. Because people, you start getting tired and you start feeling all those things. I thought, yeah, and I was like, but do you have to be depressed all the time? And so Susanna told me, you need pellets. About 3 or 4 days after my first batch, I was like, oh yeah. I felt more like I did 15 years ago. And it was like you said, she said, it won't make you go to the gym, but when you get there, you will be glad you'll do better. And so I noticed that, I want to go to the gym, and now I haven't lost the tons of weight or anything like that, but
Takes time.
I feel better.
Do you?
And I feel better here. It was like, I was glad to get my second batch because I'm dealing with that, but, and I sleep like a rock.
It's been there for about a year now.
Okay.
I mean, my main thing was joints and stuff. I mean, from working out over the years and everything, my shoulders had started bothering me, my knees were bothering me. It's bad. My knees used to sound like Velcro when I was working out and everything.
Wow.
I mean, but now back to squatting, back to doing more heavy leg workouts and stuff like that. And it don't bother me at all. My shoulders aren't hurting anymore. And working long hours and stuff on the weekends, I got to the point where I was like, I just wanted to sit around and sleep or be lazy on the weekends. And now I'm back out doing stuff and doing what I should be.
Congratulations on your success. Great. Anyone else? By the way, a couple important nutritional, but these are very hormone-specific nutritionals that are critically important, especially the DIM, the ADK, the probiotic, and certainly the methylguard B. These are things that make the hormone pellets last longer and work better. So she'll share that with you as well.